Hey everyone! In today's video, we're diving into the OET writing letter format. From layout to structure, I'll show you exactly how to organize your letter the right way. Let's get started. The OET writing subtest is designed to assess your ability to communicate effectively in a healthcare setting. You'll have 45 minutes in total, 5 minutes to read the case notes, and 40 minutes to write a letter based on them. The expected word count is between 180 and 200 words. The letter could be a referral, discharge, or transfer letter, depending on your profession. This task tests how well you can organize information, use clinical language appropriately, and write clearly and professionally for another healthcare professional. In the OET writing subtest, you may be asked to write different types of letters depending on the scenario. The most common are referral letters, where you request further assessment or treatment for a patient, and discharge letters, which summarize the care provided and guide follow-up after a patient leaves the hospital. Transfer letters are used to share relevant patient information when they're moving to another facility. You might also encounter information letters, which offer health-related advice, or request letters, where you ask for support services like home care. Each letter type has a clear purpose and audience, so understanding the format and tone is key to scoring well. A well-structured letter is essential in the OET writing subtest. Start with the date at the top right corner, like the 9th of January 2025. Below that, include the recipient's details, their name, title, and address. Begin your letter with a polite salutation, such as, "Dear Dr. Smith," followed by a subject line that briefly summarizes the case. For example, Re Mr. John Doe, DOB, December 12, 1970. Your introduction should clearly state the purpose of the letter. In the body, include relevant medical information, social history, and clinical findings in a logical flow. End with a conclusion that outlines your recommendations or the next steps for the patient's care. Finally, close the letter with yours sincerely, followed by your full name. Keeping this format in mind helps you stay organized and professional. The introduction is one of the most important parts of your OET letter. It sets the tone and immediately tells the reader why you're writing. A strong introduction includes the patient's name, age, and main medical issue, followed by the purpose of the letter. For example, I am referring Mr. John Doe, a 54-year-old male, presenting with recurrent chest pain suggestive of angina. This kind of sentence gives the reader a clear snapshot of the patient and what action is needed, making the rest of the letter easier to follow. The body of your OET letter should be organized into clear, focused paragraphs that present information logically. In paragraph 1, describe the patient's medical history, current treatment, and how they've responded so far. This helps the reader understand the background and ongoing management. Paragraph 2 should focus on clinical findings, such as examination results, lab reports, vital signs, or imaging studies, giving a clinical picture of the patient's current condition. In paragraph 3, include relevant social or lifestyle factors like smoking habits, alcohol use, living arrangements, or occupation, as these can influence the patient's care plan. This structure keeps your writing clear, professional, and easy for other healthcare providers to follow. The conclusion of your OET letter should neatly tie everything together by summarizing key points and making a clear recommendation or request. This final paragraph lets the reader know exactly what action you're hoping they will take. For instance, you might write, "Further investigations, including a stress test and possible angiography, are recommended." This shows that you're not just passing along information, but actively guiding the next steps in the patient's care. A clear and purposeful conclusion helps the recipient understand what is expected, making your letter more effective and professional. To wrap up your OET letter, it's important to maintain a polite and professional closing. Use a formal sign-off like, "Yours sincerely," followed by your full name and designation, for example, Emily Green, registered nurse. This adds credibility and professionalism to your letter. If needed, you can also include optional sections such as enclosures for any attached test results, or a reference number if the case requires one. These final touches ensure your letter is complete, respectful, and ready for clinical use. To succeed in the OET writing subtest, it's important to keep your letter concise and relevant. Only include details that support the purpose of your letter. Always maintain a formal and professional tone as you're writing in a clinical context. Make sure to follow the standard OET letter structure so your information flows clearly and logically. Finally, don't forget to proofread your work for grammar, spelling, and punctuation errors. These simple yet powerful tips can help you write a well-organized, high-scoring letter with confidence. Thanks for watching. Keep practicing and stay confident. See you in the next video.